I'm here at the first annual 2024 Cell Coast Conference, sponsored by Moffitt, where we talk about the treatment of cancers with cellular therapy, with cells. Now, what you spoke about today was bispecific antibodies. Tell us how that can be a cellular therapy.
Yeah, so this is another way of redirecting your T cells, right, your immune system towards killing cancer. So that's how it works, right? Like these bispecifics engage an antigen on the surface of the tumor cell, and then the other antigen goes and activate a T cell, right? Activate a cascade of killing cancer, right? So that's how they work. And there are other type of reactions as well along, like cytokine increase that also lead to cell death, in this case cancer. Yeah, that's how these bispecifics, even though they are not itself cellular therapy, redirect cells to kill cancer.
And so tell us about the experience of a patient receiving a bispecific antibody. How does it work in terms of their hospitalization and the ongoing treatment?
Yeah, so when these bispecifics first came, most patients will be having what we call the step-back dosing, right? So it has been built a program of stepping out doses to try to minimize toxicities. So they start with a very low dose, and then after a few days they get the second dose until they get to the actual treatment dose. And by doing this, we can minimize toxicities. So most patients has been admitted for this step-back dosing, right? So they are admitted to the hospital. Depending on the product, their hospitalization could be anywhere between 5 days to 9 days, and then they receive the first step-back dosing in the hospital, and if everything looks good, then they get discharged and continue the therapy as outpatient. Now we're trying to move away from that model, and we're trying to do also the step-back dosing in the clinic, right? Without needing to have the patient admitted to the hospital. They just need to be in a distance from the hospital, right? About an hour. They need to have a caregiver that is reliable, that can contact us if something doesn't look right. And then by giving these patients prophylaxis, in this case tocilizumab, we're trying to keep those patients in the outpatient setting to receive the therapy, right? That way we can decongest our inpatient service, in this case the sonic service, and we can also offer to most patients, right? Not many patients want to be in the hospital for a week or 9 days just to receive therapy, right? They prefer to be, if possible, at home and come back and forth if that's possible.
And what are some of the cancers that are currently being treated with bispecific antibodies?
Well, we have multiple myeloma, we have non-Hodgkin lymphoma, we have like non-small cell lung cancer, and uveal melanoma. So a total of acute lymphocytic leukemia, right? So a total of like 9 FDA-approved agents that we have available at the moment.
Yeah, and I think more to come in years going forward. So I think these types of programs to deliver these in the most effective, patient-centered, safe ways are really important. So thank you, Dr. Castaneda. I really appreciate your expertise and looking forward to all that comes